Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Awesome. I have another question here. Could you please address the issue of age with concussion recovery? I've had multiple concussions in the past, but with this one I'm having more memory problems which are not improving at 6 months post. I am now over 60, an age that people without concussion develop memory problems, and I'm afraid that the concussion is accelerating this. I know that you feel that concussions are not necessarily related to CTE, but if the concussion happens at a later age, I'm afraid that it could accelerate memory loss. My other symptoms are not resolving this time the way they used to either.
Yeah, so there is evidence that people who, these are usually large, like population-based studies. There was one from Denmark a couple years ago that found that those that had concussions at a later age, like 60, 65 plus, tended to have increased risk of dementia and cognitive decline. It's a slight increase, like it's not like it's guaranteed or anything like that. So yes, there is an increased risk. The other thing to, consider is that a lot of cognitive problems, especially in concussion, and the research supports this across the board, that in the majority of studies, people that complain of cognitive problems after a concussion actually test normal for cognitive function. Because your mind is powerful, if you start to think and believe that you have cognitive problems, you'll start to see more and more evidence of it. Right? So if something were to happen, like you forgot to pick something up at the grocery store, and you come home and you're like, oh man, I meant to get potatoes and I forgot. And then you start blaming concussion. But people have these momentary lapses all the time. That's just kind of part of life. But if you're attaching value to it and you're attaching that kind of emotional component to it where you feel that, oh, this is my brain is damaged because of my concussion, it's going to make it so that anything that happens, you're going to start to feel that happens more and more and more. So across the board, most of the research shows that people that complain of cognitive problems after concussion don't actually have cognitive problems. They test normal. And the people that complain of cognitive problems, that's mostly associated with mental health issues. So anxiety and depression. Those are the two most common ones that are associated with cognitive problems. Because if you are anxious, your mind will be super, super active and you're not able to focus on what you're actually doing because your mind is kind of spinning and it's elsewhere, right? So we see this in that thing I talk about, which is like default mode interference, right? Your default mode is the internal dialogue inside your mind. And you have the other network, which is your executive network, when you're focused on a task and you're doing something. Those two networks generally should work in opposition to one another, meaning that when your default mode is on, your executive network turns off and vice versa. So when you're focused on something and you're dialed in, your default mode network, that little internal voice inside your head, shuts off. Now, with concussion injuries, we see activation of both networks at the same time. But what we also see is that in people with anxiety, we see activation of both networks at the same time. So that impacts your ability to focus and concentrate. So the treatment really here is to focus on calming the mind, right? So we want to focus on reducing that rumination, focusing on the kind of mindfulness-based things, but also cognitive function is related to other symptoms too. It's hard to focus and concentrate when you have a headache all the time. It's hard to focus and concentrate when you feel dizzy, right? So I think there's a few things that go on with cognitive impairments. One is if you start worrying about it, you're going to start to see evidence of it everywhere. If you think, oh my God, I have this, it's going to just continue to happen. And that's kind of the relationship to the suspected CTE cases where people think I've had a number of concussions and now I'm having these cognitive problems. So therefore it must be related. And then they start to see evidence of it everywhere. So that's one facet. The other facet is that if you are in a state of hyperarousal and your mind is super active and worried about things, that's just going to increase your cognitive impairment because you can't focus when your mind is moving a million miles a minute. So we need to bring that down. And also doing the other things in the program to reduce overall symptoms, cognitive function should improve, right? Cognitive function is related to chronic inflammation, right? The new kind of terminology around Alzheimer's disease is diabetes type 3, right? Because it's just a chronic metabolic inflammatory thing that happens over our lives. So how can we help to mitigate that? We reduce inflammation in our bodies, and that's part of the program as well. So everything in this program is geared up not only to help you recover from the symptoms you're currently experiencing, but also to give you a good starting point for the rest of your life to reduce all the risks of all these other kind of chronic diseases that happen as we age. So yes, there is increased risk if you get a concussion later in life. However, there's a lot of other potential answers or reasons for why you're experiencing this. And number one is going to be kind of the mental health, anxiety, rumination piece. Number two is going to be inflammation. Number three is probably autonomics, right? And reducing that sympathetic drive. So all of those pieces in place should start to improve things. And if you can kind of take a deep breath and kind of calm your mind down a bit, I'm sure that'll help over time. Anything to add from Melinda or Paul?
I think you explained it really well, Cam. Just this sense of how multi-layered it is, but also how important it is to kind of go back to those foundational elements. And I think when anyone reflects on their own experience, they can get a sense of where those issues might be. And if you don't have sort of an intuitive sense, oh, wait, you know what? I am experiencing a lot of anxiety, for example. Maybe that is why my mind is feeling so scattered right now, right? We also see a lot of ADHD, post-traumatic stress. All of these things following concussion, especially if it was a traumatic way that concussion occurred, can create scattered thinking, if we want to call it that, right? This inability to kind of focus and concentrate. So there's so many components to this, and I think Dr. Cam's done a great job of sort of explaining what all those layers are. So my only comment would be, assess for yourself. Is it intuitive to you, where you might be as you've already been through the program? And if not, start at the beginning, right? Start at the beginning of the Concussion Fix program. We'll take you through everything mindset related that will help you be able to understand whether there's any components in your mindset related to this worry about Alzheimer's. It's 100% true, right? The more we think about something, the more likely it is that we start to see it everywhere. It's just the way the mind works. And there's lots of exercises we have in the program right at the start that can help walk you through that. And hopefully you'll get a little bit of a roadmap for yourself to identify, where might this concept be coming from, and where do I need to focus my attention?
Yeah, well said. Nothing to add other than the only thing you can really do is just focus on completing the course. Go ahead and do it right now, because thinking about, is this somehow going to predispose me to dementia or anything along those lines, is unproductive in any way. And even if you were going to go to your doctor to say, oh, listen, I think my concussion's going to predispose me, they have no idea what to do with it. There's no treatment in any space that's going to help you in the conventional side. So the best thing is to work through the modules and address everything that Dr. Cam and Melinda talked about. Well said, guys.
One more thing to add on that is that if you have gone through everything and you've been diligent on the diet, you're reducing your inflammation, your sleep is good, your mental health is good, you're doing all the kind of stuff from Melinda's modules, you don't have any physical pain, like you're not having headaches anymore, you have no more physical symptoms because you've addressed them all with this program, but you're still concerned about the cognitive side and you still are feeling that you have issues, then that's when I would suggest you actually try to book in with a neuropsychologist and have a full cognitive assessment done to see, do I actually have cognitive problems or not? Now, the thing is, if you have headaches, then your neurocognitive assessment is going to be abnormal, right? So I would try to address all those other facets first so that everything else is good. And then you go and say, okay, the last remaining piece seems to be this cognitive issue. Then you go and actually get it tested. Is there something there or not? And that can just give you a little bit of peace of mind if there's nothing there. Or if there is something there, they can give you some strategies and cognitive rehab exercises to work on those pieces. But the first step is still building that foundation and making sure you've addressed all the other underlying issues, like the inflammatory, the mental health, the autonomic, the physical symptoms, the headaches, the dizziness, whatever else. If all of that goes away, generally cognitive function goes back to normal. However, if it's still remaining, then you want to get a I think an occupational therapist can do it as well, but a neuropsych is really where you want to go. Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.